Hi, my name is Megan Getter, and I'm going to be doing a respiratory assessment on my client Tina. She is a 56-year-old female with a history of slight asthma and non-allergic rhinitis, and she was also diagnosed with flu type A about 8 days ago. And so I'm going to start by just inspecting the skin around the nose and the mouth and the chest area that I can see. And just by inspection, I can see that there's no abnormal redness around the nose. The skin doesn't look abnormal. It's insignificant. I can see that just by palpating, I can see that the trachea is midline. And then just by inspecting some of her breathing, I can see that inspiration and exhalation are equal. That is something you want to look for to see if inspiration is or exhalation are at different rates to each other. Next, I'm going to be looking for abnormal tactile phrenitis, just feeling for the different pitch and vibration when somebody is speaking, and feeling for different depths in the chest wall and at the back where the shoulder blades are. So I'll have my client go ahead and turn, and then by using my fingers, I will feel for the structure of the back of the shoulder blades, and then I'll have the client repeat 99.
99, 99, 99.
And then I'll have the patient turn, and I'll do the same thing to the anterior side.
99, 99, 99.
And so it felt equal as I palpated whenever she was repeating the word 99. You can also use the numbers 1, 2, 3. Usually tactile phrenitis is increased when there is a lot of fluid on the lungs or there's a mass present. And then sometimes it is decreased whenever the structure of the wall is hardened, the walls of the lungs are hardened, whenever there's a lot of fat or tissue on a patient, and sometimes whenever the structures of the wall are hardened by diseases such as emphysema. And so just by palpating, I can tell that there's no abnormal crepitus. And then just taking my pen line, I'm going to look at the back of the throat. You can stick your tongue out a little more. So I can tell that there's a little bit of redness at the back of the throat. There's no abnormal tonsillar swelling. I'm going to go ahead and start at the anterior side, and as I'm listening, I'm going to try to listen at each intercostal space, going opposite each side, and then listening at each side as I go down. I'm going to move your shirt down a little bit. And I noticed just maybe a little bit of expiratory wheezing in the lower lobes of the lungs. And as you're moving down, you want to make sure that you're listening for at least one breath on each side. And then I'll go ahead and have the patient turn, and I'll listen posteriorly. Usually, whenever you're listening to the anterior side of the patient, you're hearing the tops of the lungs, the top lobes of the lungs, and now I'm going to listen posteriorly. And so you want to make sure that the patient sits up very tall and is able to separate their shoulder blades. Yeah, so the tops of the lungs seem clear, but just that little bit of expiratory wheezing as she was breathing out. And so just with her recent flu diagnosis, I would definitely recommend to the client that she go through her whole Tamiflu antibiotic regimen that was prescribed from her doctor, taking all of her steroids, making sure that a dose isn't skipped, and that she takes all of her medication, and go ahead and continue her sinus flushes, which she's doing every day. And then I would also recommend using Advil or Tylenol for any fever or pain that is experienced as she's getting over the flu. Thank you.